Good evening, everybody, and welcome to the Putnam County Physical Services meeting. If everybody would please rise and join Legislator Crowley in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Roll call, please.
Legislator Crowley,
Present.
Legislator Yonke,
Present.
Chairman Elner.
Here. I move that we accept the minutes of the prior November 12th meeting. Do I have a second? All those in favor?
Aye.
Okay. We have before us 3 leases. They've been vetted by the county law department, and I've been in contact with Jen Caruso of the county executive's office. Unless someone has a question for separating them, I'd like to move to approve all 3 of them at the same time. Are there any questions or concerns on any of these leases from members of the committee? Legislators? Public? Okay, so then I move that item 4, we approve leases for Cornell Cooperative Extension, Putnam County Action Partnership, CAP Westcop, and also United for the Troops. Do I have a second?
Second.
All those in favor?
Aye.
Aye. Item 5 is the approval negative declaration for SEQRA at Snake Hill Road or over Philipse, Brook, Culvert. This is a replacement, and if we have any questions, Commissioner Barossa is here. Committee, do you have any questions on this? Legislators?
Maybe Barbara can just give us a quick idea of what's going on.
So the legislature declared lead agency in December. The EAF and lead agency notice was circulated, and this would be concluding the environmental review.
Thank you.
Again, any questions, concerns from the committee or any legislators? No? Okay. Being that the case, I move that for item number 5, we approve.
Second.
Second. All those in favor?
Aye.
And, I actually did a little error. I want to go back for a second. Commissioner Barossa was kind enough to catch something, and she gave a corrected version for some of the backup. So I'd like to move that we accept the additional item number 5.
Second.
All those in favor?
Aye.
Okay. Number 6 is also a approval for a SEQRA negative declaration. This is Peekskill Hollow Road over Wiccopee Brook Culvert replacement. Similar situation, Commissioner Barossa?
Exactly the same.
Okay, exactly the same. Questions or concerns from the committee? Legislators? Okay. I move that we approve item number 6. Do I have a second? Second. All those in favor?
Aye.
Item number 7 is for an approval for federal Title 49. This is a consolidated grant application for fiscal years 24 and 25.
So this is for funding for our transit operating for our rural funding, which we use for our Part 3, which is actually going to be turning into our microtransit system. So it will be for 2024 and 2025. They backfill, so it's based off of current service. So we would be reimbursed for 2024.
What do you estimate this is worth?
So 2024, it was 250,000. 2025, it's going to be about 400,000.
Thank you. Any questions, concerns? Committee, legislators? Okay. So I move to approve item 7.
Second.
All those in favor?
Aye.
Aye. Item 8 is also for approval to continue the Putnam County Parking and Transfer Program and the Intercity Bus Mass Transportation Joint Services Agreement to Croton Falls Commuter Shuttle. So this is where we're taking people from the park and ride in Mayapack to the Croton Falls train station.
Correct. So this is just the annual renewal of our contract with the state. It also covers our park and ride maintenance agreement that DPW handles, and we are reimbursed for. So this is just our funding agreement with New York State.
Reimbursed for 100%.
Yes.
Yes. Okay. Legislators, committee, questions, concerns? No? Yes.
Just a quick question. What kind of traffic do we get on the shuttle? Do we know what census-wise or population? I mean, I think it's a great idea. It just keeps.
I can actually get you the numbers. I want to say we had about 5,000 for the year.
Okay.
I might be misquoting. I have the numbers.
Yeah. I'm a lucky commuter. I park near my train station, but I know not everybody does. So this is a good service for folks who are able to do that. So thank you. Thank you, Chair.
Okay. Any other questions? Okay. So I move to approve agenda item number 8.
Second.
Second. All those in favor?
Aye.
Number 9 is also for approval for the county to be the lead agency for SEQRA determination, Terry Hill Road and New York State Route 311 intersection improvements.
So this will be declaring lead agency and beginning the SEQRA process.
Thank you for the correction. So we will be declaring, okay, we're beginning the process. Thank you. Any questions of the committee? Yes.
Quick. Well, what are they planning to do at that intersection? Straighten it out a little bit?
DPW may want to speak about this, but I believe it's
enhancing the safety and actually putting traffic light.
At Terry Hill?
And widening the lanes, yeah.
Okay.
Turning lane sidewalks and just general kind of geometric improvements to the overall intersection there, so.
Okay, that's what I meant, to kind of straighten it out so that when,
Somewhat, yeah, so we're widening it off on the Terry Hill side.
Got
on
it.
The approach to 311 there. Kind
that
of
makes sense,
eliminating
yeah,
that
it
turning
is dangerous.
hazard, yeah, so.
Thank you.
Got it.
the plans were attached to the
Oh.
Preliminary, right?
Joe and Tommy, if this everything gets approved, when do you estimate the possibility of starting the
We're
construction?
we're aiming for the summer.
Okay.
I think, yeah,
Design's done.
if all goes well. But
Sounds good. Any other questions, concerns? No? So I move to, I move to approve number 9 on the agenda. Do I have a second?
Second.
Second. All those in favor?
Aye.
Agenda item 10 is approval ratification of an application for 2025 grant funding through the New York State County Infrastructure Grant Program. This is from Empire State Development, and this is for the roads we were just talking about, Terry Hill Road and New York State Route 311 Infrastructure Intersection Improvement Project.
Correct. New York State is basically making eligible all of the counties for infrastructure projects, basically $500,000, up to $1 million if it's associated with housing, which this is not. So this is what the county was looking to fund,
Is that per project or total?
total.
Okay. Committee questions? Legislators? So I move to approve agenda item 10.
Second.
Second. All in favor?
Aye.
Number 11 is for us to submit to be the lead agency for secret determination. This is for the exterior restoration of the county historic courthouse.
So this would be initiating lead agency and opening up the environmental review. And because this is a historic courthouse, it is a type 1 action and requires a more in-depth environmental review. And we will have to involve SHPO and conduct a full in-depth review.
For the people at home, could you please elaborate on the SHPO
The State
acronym?
Historic Preservation Office.
Thank you. Legislator Crowell's got a question.
Because it's the historic nature of it, are we eligible for any grants that could help preserve those?
I've actually been trying to get funding, I want to say probably 4 or 5 years for this project.
And it's on the register? We have it?
Yes.
Okay, so, good to know.
So I have been applying, we haven't received funding yet, so I've partially, I think, because we haven't done the SEQRA. So
Right.
now we're moving ahead with the SEQRA, and hopefully funding will open up.
Great,
as a result.
thank you for all your diligence.
Any other questions? Legislator Birmingham.
Yeah, to all three, since the 94 reconstruction, when it was essentially gutted in 94, I know a lot of this project's focusing on columns, which, as you guys have identified, are pretty, water soaked and everything. Is there any restrictions we have, and maybe we don't know that yet because it'll be part of the study, but are there any restrictions we have because it is a historic structure? Can we have some materials that perhaps will last a little bit longer than just the 30 years since 94? And I do know, we all know wood gets waterlogged, and especially being exposed to the elements. And you might not know the answer to this question yet, but I was wondering if we could look at any other materials, and we might not be because it's historic.
There are a couple of things in the backup.
There are? Okay.
Yeah, so the seal on the outside is wood, like
Yeah, right.
you're correct, right? But it's not structural. So the structural component of it is sound. The idea, though, is to obviously make everything sound. So the seal on the outside you see, and then adding weep holes to it, and including a baffled aeration system to pull moisture out of there is part, you'll see it in the backup. It's in there. That's one of the ideas.
Thank you.
Just
Legislator
that
Montgomery.
idea, thank you, that idea still is subject to SHPO review, and oftentimes SHPO comes back and
Yeah.
says, you have to do what was done in 1850.
It won't change, right, through the chair, it won't change anything that SHPO owns structurally or even aesthetically, but there's a space in the, kind of in the ceiling of it, and that we can do that, and nobody would know the difference, and it's gonna make it last a long time, so. Right now, it's gonna order to escape.
Thank you.
Being that there's no other questions, move that we approve agenda item 11. Do I have a second?
Second.
All those in favor?
Aye.
Agenda item 12 is the, yes, I'm sorry, Legislator Montgomery.
If I could just make a comment, thank you, that we just went through 7 items from county planning, and I just would like to thank Commissioner Barosa for doing your due diligence, and I know the amount of administrative work that goes into this and coordinating with state regulations and complying with the funding that you get, in addition to communicating with all the outside agencies as lead agencies. And I know you're working without a deputy commissioner, and your workload is unbelievable. I mean, how long have you been commissioner? And I'm just really excited to see the level of infrastructure projects that we're doing, and especially when we're in my district, it makes me really happy. So I just wanted to say thank you to the commissioner, because this is just an unbelievable amount of work. Thank you.
You're here.
Thank you, Legislator Montgomery. Okay. And we have our gentleman from DPW right here. So number 12, we're looking for an approval, authorization for implementation and funding in the first interest. Okay, 100% of federal aid and state aid eligible cost of a transportation, federal aid and/or state aid transportation project. Can you please elaborate on this briefly?
Get the mic.
This is, like you said, this is the first instance of funding for a Bridge New York project located in Patterson on East Branch Road for a bridge deck superstructure repair, basically the deck, so. We've identified that as a.
So this is the
as an
first
issue.
step in order to get the funding.
Correct, yeah.
Okay. Questions of the committee? Legislators? Move to approve item 12.
Second.
All those in favor?
Aye.
13, looks like it's the same situation, so it could be eligible, and this is for a different project, okay? This is for Peekskill Hollow Road over Peekskill Hollow Creek bridge repairs. Oh, boy. Sorry, everybody, okay? Anything you'd like to add to that?
Yeah, so before Legislator Goldman, here's Peekskill Hollow Road again. This is on the north end of Peekskill Hollow Road. These are identified through state inspections, and we do our own inspections also. So this is trying to get to fix a problem before it becomes red flagged and kind of deteriorate to the point where we can't use it, or we've had to change weight limits, things like that. So these are all part of that process. And we were able to do some work ourselves last year, improving failing bridges so that they'll actually get past, what was Donesburg? Donesburg, we did some work last year, which will probably get us another 10, 15 years out of it. So, but we'll continue with the state's advice on their inspections. And you'll see this will come up probably 2 more coming this year. Or 2 more coming up.
Exactly. So the state inspects them every 2 years. We're just trying to be proactive and avoiding, any kind of flags that we might,
Get ahead of it, fantastic, guys. It's wonderful.
And these are 2 high priority bridges, obviously, here, so.
Questions, comments from the committee? Other legislators? Legislator Goodman?
Thank you, Chairman. I've had a few questions recently about the completion of that bridge. Any idea when it's going to be done?
I don't see this on the agenda. Just kidding. It's actually going great. Second lane's finished, even the side rails are complete. We'll have, we're at substantial completion, so, which is great. It'll be open, should be open next week. The weather's hindered it, obviously. And then we'll have the punch list, and I don't think we're gonna have any parade going across that bridge like people in the past, but.
But both sides are going to be open?
Yeah.
Yes.
Yeah,
Because I saw them working on it the other day.
Yep.
Which is very good.
yeah. So,
Thank you.
very good shape down there.
The traffic lights will be removed too, finally, after
Right.
2.5 years, so.
Any other questions, comments? So we'll move to approve agenda item 13. Do I have a second?
Second.
Second. All those in favor? Aye. Item 14 is the approval acceptance of Amendment B. This is for 2022-2023 fiscal year snow and ice agreement with New York State. Deputy Commissioner Belushi, this is your wheelhouse.
Yep, so this is our annual reimbursement from the state for maintaining their roads. I think we do 34 total miles, center lane miles of state roads throughout the winter season. So this is the first step in the process for reimbursement. Once we get this resolution, we can present it back to the state, and then they apply a winter severity index, I think it's called, to that, and then we take it back, and they pay us 67% of the costs we finalize with them. So
What are you estimating the income will be, incoming cash flow
it's
will be?
in the backup.
It's in the backup. I didn't catch that. I was asking.
Yeah. The state was adamant about that, so.
That's looking materials. So we're looking about 1.1.
Excuse me?
The state doesn't like to,
It's not final yet. Once the state
Okay.
has to approve it ultimately, and then they cut the check for 67% at first. And then
Okay.
balance after that,
So 67% of pennies, got it.
so. Yeah.
Any other questions or comments? Move to approve item 14.
Second.
Second. All those in favor?
Aye.
15 is a similar one we got over here, except this is for fiscal year 2023 and 2024.
Yep, same deal, just the subsequent year.
Okay? I move that we approve. Do I have a second?
Second.
Second. All those in favor?
Aye.
Thank you, gentlemen.
Thank you.
Now, item 16 is for approval of 24 CP01, a software purchase. And we have IT Director Tom Lannon with us. Welcome, Director Lannon.
I have to bring my own chair.
It's BYOB.
Good evening.
Bring your own budget. How are you?
I'm good. How are you?
Hey, Tom.
It's not snowing yet.
Yeah,
We're good.
live in Virginia though.
So this is a request to put aside funds so that we can purchase, effectively, it's a module that will work with Munis. I'm sorry, I'm going to go into it a little bit so everyone's familiar with Munis. That is the backbone of everything we do financially. It's great software, but if you've been in it, it is not user-friendly at all. So we have two departments that were kind of making similar requests. We were able to leverage the fact that they both needed software, and I found this company who you may have all visited because they've been at NISAC a lot. They are throughout New York State. They're actually across the country. They work specifically with governments. This is one company that we're looking at. We haven't made a final decision. We would just like to put aside the money. The two departments in question are the Parks Department and Consumer Affairs. And each one has a unique problem. Consumer Affairs, as you know, handles contractors, electricians, and plumbers. They have to do renewals of permits. They have to keep records on each contractor that comes in. It's a lot of work, and Munis is not the vehicle to do that in, and they're trying to do it in Munis, and it really is, it's not customer friendly on two fronts. It's not customer friendly to us to go in and do the work. It's horrible, and it's not good for the constituents to go in and upload their information. It's really antiquated. In fact, a lot of the contractors just don't use it. They still come in the old-fashioned way and drop off their paperwork. So we're trying to get them into something a little more modern and make it a little bit easier for the public to use. One of the important things is that this program works, and I have to be careful about how I say that, it works with Munis, does not interface with Munis. Munis doesn't allow any program to interface with it, which is exactly what we want. We don't want a program that can go into our financial software. But what happens is at the end of the day, you do an export from this program that's automated, and then you do an import into Munis, and you're effectively done. So everything can go from one program right into the other, and the two don't really talk to each other, so they're separate vehicles. In addition, we can accept payments online, which is very beneficial for us to allow someone to sit home and do it, which they really don't do in consumer affairs right now. So that's that project. Then we go into Parks, and Parks has been looking for a long time to get software that will help them do their job a little more efficiently at Parks. And anyone who's been to Parks knows that they have different areas. And I'm speaking for Chris. I believe he's out sick, so he's not feeling well. But I can explain the process, and I know that Tom and Joe are here, and they can help explain it if needed. But they have several areas. People that want to go into the park, if they want to go in for the day, they get a day pass when they go in. If they want to book the gazebo, let's say, they could do that. They can get, do a party there. And right now, they're doing that by coming in person. There's just no other way to do it. It is not efficient. They also have the plots that they use for the gardens, and I'm sorry, I just don't remember what that's called. Across from Tilly Foster, where you can
Community garden.
the community garden, I'm sorry, the community garden, which is a great project, but right now there's no way for them to do that either. So this is all being done From the public's point of view, it's not the right way to do it, but then taking it to Chris's point of view, it's horrible. He has a young lady that works in the office. She has to take all this information. She's actually putting it into an Excel spreadsheet, then taking the Excel spreadsheet, they're taking the information, trying to upload it into Munis. The whole thing is really not the most efficient way for us to do business. So when we reached out to this one company, trying to solve one problem, we looked at it and said, we can solve both problems. And they said, well, if you solve both problems, we'll give you a huge discount if you do both at the same time, which is the way companies do business. So that's kind of where we're at today with both programs. Both departments, Parks and Consumer Affairs, sat through a demo on this particular one, and they both said they had no problem with it. Parks, and I'm going to go on record to say Chris's first comment was, that's expensive for what they do. And he acknowledged that. And he said, we just don't take in a lot of money. But he said, boy, would that solve our problem. So he acknowledged that. But I said there's efficiencies in software. And that's what we have to look at, is the efficiencies within his office, making the job easier for the person that has to manage all of this stuff coming in. And it's quite a job for her, and also we have to look at it from the public's point of view, making it easier for them to do what they want to do and interact with us. So that's where we're at.
Okay, just before.
Sure.
Is there a maintenance fee
So
or a
there's
subscription associated
Yes.
with the software?
this is a license program, so every year we would pay a recurring charge for it. In the first year, you have implementation fees, and you don't pay that going forward after that. You just pay a maintenance license fee.
Okay, and what I was looking for in the backup is what are the implementation fees and the subscription fees?
So I can tell you, but we haven't picked this particular company. We just want the ability to pick a company and then go forward with the company at that point. I do know what it is, and they're kind of changing because it depends on when we go live with them, because it's a yearly subscription, so we'd obviously be prorated for when we start with them. But I do have my notes. I don't believe this was provided to you, because like I said, we didn't pick this particular company. This is the company that I think is the
Talking
best.
round numbers, what are we looking at?
You're looking at round numbers for both Parks and Consumer Affairs for implementation and the first year of about $99,000. And then the recurring costs after that would be around $72,000.
That is pretty expensive. Okay. Legislator Crowley?
That's both combined, though. That's not just one. So that's both.
So I'm going to piggyback off of Legislator Elner's a little bit. He asked about maintenance fees and things like that, but also too, if a customer is paying, are we charging a fee with that for convenience?
Well,
That will help cover costs, or is the company getting some sort of surcharge because they're using a credit card?
This company doesn't get anything for that, but there is a company they interface with that handles that. I believe the legislature already approved absorbing the fee. We don't normally do that, but I believe they did for Parks, and they would have to speak to that. I don't know if Tom or Joe know the answer for that. I believe that was approved like 3 years ago to absorb the fee.
Yes.
And so they increased their fees to offset that, to kind of build it into the price.
Okay, and then secondary, through the chair, if you don't mind, because it's Parks and Rec, again, I'm going to go back to grants. Is there anything that we can shuffle around and look into? Because if it's interfacing with our park system, can we reach out to the state to see if we can find any sort of grants that might help with technology in the park system?
I'm not aware of any, but certainly we could look. I'm not aware of any specific to that. They're really, the grants that are available are really cybersecurity focused grants, is typically what we see.
Legislator Yonke?
Hey, Tom. So we're gonna spend $99,000 the first year, $72,000 every year thereafter. How much money does Weights and Measures and the parks, how much do we take in every year?
I don't know, Legislator Yonke. I wish I did.
Is it more or less than $72,000?
Combined, it's more. Parks does not bring in the same amount that the software would offset.
I would hate like heck to spend $72,000 in software for a collection of $50,000. The other thing.
It would be offset.
What makes me really uncomfortable is that there's a request here in an amount not to exceed $150,000. I think we're doing things backwards. Before we grant you the money, which is money that was saved through DPW, I think you need to go through the process, the RFP process, and bring us the name of the company, and then we approve it. I don't like the idea of writing a blank check and then whatever happens, happens.
I understand that. And the reason that it's in being presented the way it is there is a time constraint on this because park season begins in a couple of months. In order to implement this, they need like 4 months to implement the program to get it running. So we were trying to get ahead of it and be able to.
Then it's not gonna happen in
It's not gonna
2025.
happen. If it's gonna take 4 months to implement it, we're gonna miss the season for parks, because pretty much everything is gonna be done by the end of April. I mean, March through April is the crunch, and that's when they're gonna need it, so.
Even if we got it approved at the March, let's say we jammed this thing through and got it on the March agenda, 4 months is, and you know, nothing happens overnight.
Right.
4 months, even if it took you to June or July, what good is it gonna do the parks? You know,
So their goal.
Parks are closing in September.
Their goal, and through Chris Ruthven said that their goal was Memorial Day. That's typically when they get very busy at the park because that's when the lake opens. So that's when it gets very busy for them.
But I'm
and that
sure
was the date.
people start signing up long before Memorial Day.
I don't really know. He said he needed this by Memorial Day. That was his date.
Yeah, which I don't see how it can be done. Legislator Crowley.
How many contracts come with this licensing software? Like how many different departments could use this? Is this something that could be worthwhile in other departments for the same price, or is there only a certain amount of licenses that they are giving out to use?
So that's a very good question. The parks one probably is of no benefit anywhere else, but the licensing one could be of benefit, and it's unlimited licenses. So they don't.
So if we spoke to other departments and it would, if you've got a number for us, if we were to put it out and see how efficient it would, I would like to know the answer for that. If it would be more efficient to our other departments, then maybe that number would be something that was easier to swallow if it could be of service to our other departments.
The one that they were kind of focusing on was actually the health department, where they said you could do food inspections and you could use this program to do that. I do know through our health department that we have to use something called eHIPS with New York State. Nothing interfaces with that. It's kind of a standalone program. So the health department has said, well, we don't want to do double work, which you can't blame them. Even though eHIPS is old school, put the information in, it doesn't help you with scheduling, but they would be doubling up their work. There is no interface for that. I don't know of any other.
County clerk.
A county clerk has their own system, and they're very happy with it.
Okay.
It does exactly what they need it to do.
Okay.
Legislator Sage.
Yeah, that was my concern. I thought has it been an RFP, and what are the other companies, and has a company been, how do we know? We can't really ballpark this. It would be nice to have it.
We don't need to do an RFP because they're on a list that we can get to them easily. So
But the other companies, I mean, you said there's other companies.
there
that
are
could be considered.
there are other companies. I know who they are. They don't do this as well. They're not government focused. This company only does government, and they're government focused. And there's several towns around us that use them in Westchester, especially on Long Island, and there's numerous counties that use them. So they have experience in the field.
I mean, I share the concerns that you all do. Is I would be uncomfortable just writing a blank check without knowing exactly what we're getting for it. And through the chair, one more thing. I did get the numbers for Parks and Rec from our auditor. I don't have, I didn't get the ones from our Consumer Affairs, but just to give you an idea, last year we were budgeted $22,000 for Parks and Rec, and we were right on budget last year. The year before, we budgeted $20,000 for fees and things, and we exceeded that. It was $32,160.50, but it's usually around $22,000 a year. So that's what we're talking about as far as fees from the parks. Just giving you that information.
Legislator Yonke?
Thank you. Tom, it sounds like you've selected the company.
Pretty much, yeah.
I would really appreciate if you tomorrow shared
Oh,
the
absolutely.
literature that you have with all of us.
Yes, yes.
Because what we have here, you're asking for a funding request of $150,000, and there's nothing here.
Yeah.
Legislator Crowley and the legislator Sage.
And we're also expected to bring in less through parks because we've lowered our fees this year, correct? So it's going to be less than what we've actually projected in the past. So we have to take that into consideration as well.
Legislator Sage.
I just wanted to address the other part of this as well. The reason that we have this money to spend, supposedly, is that we have efficiencies with our DPW department. You know, we saved money from the Board of Elections, building renovations for the new courthouse. We have 3 projects that came in under budget. We have so many projects in the county that we could use that particular money for the DPW department. I mean, I don't know that I would be, you know, I would like to keep it with the DPW department and put it towards other projects for their department. I don't know. This is not apples to oranges. This is like apples to oranges in my mind, going to software.
I'd be inclined if the department is saving money to encourage them to save money.
Right.
And also, you know, if they're giving, you know, we joke, but DPW, pave, baby, pave. I mean, anything, our roads are in such situations that I like to maximize that. Tom, you said something that this software or software modules, that it would allow for direct payments, so credit card payments,
Correct.
okay? But you said it doesn't interface with Munis. So how are we going to get the accounting information so everyone is paid? How is that going to be put into Munis?
There's an export, import. So at the end of the day, there's an automatic export that comes out, and then you import that back into Munis. So it's just a step, so we control it, and we don't allow the company
Is that
to
a
go.
manual, is that a manual export?
The export is automated, but you have to manage it. We don't let these things just happen, because if there's an error, it would go right into our financial.
Okay, I guess what I'm saying is, does a human have to initiate the
Yes.
export?
Yes, you
Okay.
want a human to initiate it.
Yep, no argument. But is that an opportunity for operator error during the export?
No.
If someone, so it's good, so all someone has to do is basically flip a switch, and it's gonna go through, and all those payments are gonna be there, all the records are gonna be there, it's gonna be searchable, and all those other things.
That's correct, because the parameters on both sides are set up ahead of time, not by the operator. They're not doing anything other than, I'm gonna export, I've got it, now I'll import it, I'm done. So they don't make any decisions.
Okay. Any other questions?
If I can add one more thing?
Sure.
I also want to point out that we are currently paying, we're looking for a final number from Munis on this, but we're currently paying around $38,000 a year for Munis to give us the consumer affairs module. So we would be recouping that money. That money would be coming back to us if we do away with their module.
Yeah, but we're still spending more.
We're still spending more for a better product, because the product we have is not working.
Okay. Well, Legislator Montgomery.
So, it sounds like we don't want to move forward with this right now, and I'm just concerned with the efficiency review by the State Comptroller's Office. And what alternatives do we have to comply with that review and the recommendations? And really, I'm more concerned with how do we bring ourselves up to the current century in what we're providing to our constituents, consumers, those who use our services. Because coming into an office to get a permit, to pay, just, I can't believe we're still here. That's my opinion.
I agree.
With a lot of things, we're still here.
Yeah,
It'd be nice to get up with the current century, actually.
and thank you, Legislator Montgomery, for bringing that up, but this is also the result of an audit that we had from New York State that pointed out that we have deficits in parks. There were deficits on how, because we didn't have any way of reconciling, and they wanted some changes made. So,
I was involved in the discussion pre and post audit, and yes, there were deficiencies, but, and then I sat with the auditor during one of the, or prior to one of the meetings, and I said, you know, is this something that we're gonna have to go cashless with? And she said, not necessarily. There are ways to do this that you don't necessarily have to go to this length to comply with the audit. So I don't know that we have to, I'm certainly a big fan of, you know, being able to pay for something online. But this sounds really, it sounds like we're losing money. I would rather hand out the passes for, it's cheaper for the taxpayers if we handed out the passes for free than bought this software.
well, to have an efficient government, everything we do is losing money. We pay salaries for all of our employees, we have vehicles. There are things that we have to do that we're going to lose money as a government, but we provide an efficient service back to the constituents. And this is an example of doing that. You have to spend money. We shouldn't look at everything and say, we have to make money on this.
I'm not saying we have to make money, but I don't think this is something that we need to lose money on.
I think it's something that, and obviously I'm a technology person, so I'm not representing parks, but from a technology point of view, this system is the way to go to make it efficient for both us as the people that have to keep the records and for the public that wants to come in and use our services. So that's how I look at it. I totally understand what you're saying, but I look at it and say, you've got to spend money to make it work.
Legislator Crowley, then Legislator Montgomery.
So I think we all want a little bit more information. It sounds like you can provide us with more information. I think it would be important to have both somebody here from Consumer Affairs and also Parks and Rec to maybe talk a little bit more with us. Is that a fair request, Chairman? It does sound expensive. Everybody has their concerns, and I think the best people to address them with are the people that are in the department and running the departments.
Legislator Montgomery.
I think it's important to state that the perception, the public perception, before the state comptroller came in, of what was happening at parks with the image of cash being collected in a parking lot and cash being collected at the various kiosks throughout the county for these events is not good. It's not good for us. It's not good for the county. The public perception was astounding before the comptroller even came in. So to enhance accountability and fiscal oversight and public access, and I too believe, and I don't know, but this could balance out with the use in other departments. I can't imagine that this technology wouldn't be useful throughout the county. So I'm a fan of progress.
Any other questions, comments from any committee members or legislator? Legislator Sage?
I think it needs to be automated, for sure. I think we need a little more time, rather than just jamming it through right now with a blank check, and pick the right program that's going to work with the right department. And, you know, this is taxpayer dollars that we're trying to be efficient with. And I think it's important that we, you know, we automate and we make it easy for customer service, because we're talking about two different customer service departments. Mm-hmm. And I don't see the rush here at this point in time. We'll get done without it this far.
Legislator Montgomery?
Is it possible that we could get the information that we need before the audit meeting at the end of February?
Absolutely. I have it right here.
To possibly discuss this again at the audit committee meeting?
Legislator Anadizio?
Thank you. I'm just looking here what this says, consistent with the commitment the county is reviewing and vetting several companies that could provide the comprehensive suite of services needed. But are we looking at several companies?
Yes, we have. We've looked at Munis to see what they provide. We looked at this company, and there was one other company that Parks was actually using that we had committed to, and we had to pull out of it. It just didn't work at all. So we had to leave that company, and they never got it going.
but you were previously working with those?
We were previously working.
That's what I'm saying, so you are looking for new programs, so have you looked at any new companies besides the one that you are interested in right now?
Well, the ones that we've looked at are the big players in the game. I mean, we can look at other ones, but this company has the history of.
No, I'm just wondering, because it says several companies, so I didn't know if you were.
I think I didn't write that memo, but I think what they meant was that we had looked at Munis, and we had a previous company that we were using, and we had experience with them.
Okay.
Legislator Yonke.
One last question. What's the name of the company?
OpenGov.
OpenGov? Where are they out of?
Yeah, the salesman is local to us, so in the region, I'm not sure where they're out of.
Okay.
What's the name of it again?
OpenGov, all one word, OpenGov.
Okay, being that everyone who's wanted to speak at this point, I think we need more information, so I'm making a motion to table.
Second.
Second. All those in favor of tabling?
Aye.
Thank you.
Thank you.
Okay, I don't see any other business.
Sorry,
Yes?
just FYI, with Mr. Lewis today, we're looking to do a budgetary transfer in order for the Quantum Hut, the museum for the veterans.
For the Veterans
We want to make
Museum.
sure we get the money and get it done in time for Memorial Day weekend. So just FYI. Thank you.
Being that there's no additional other business, I move we adjourn the physical meeting.
Second.
Second. All those in favor?
Aye.
Thank you.
I'd like to know how much the previous one failed cost as well. No, the one that whatever they were using before this that didn't work. I'd like to know how much that cost.
We're only bringing in 22,000, but it's
Maybe
been
less than
72,000
that.
a
No,
year.
so in other words, we lowered the price.
This is Ready Eddie.
Ready, Eddie? Welcome to the Health, Social, Educational, and Environmental Committee meeting. Please stand for the pledge. Legislator Russo, can you lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Roll call.
Legislator Elner,
Here.
Legislator Russo,
Here.
Chairwoman Addisio.
Here. Moving on to number 3 is the approval for a fund transfer 24T536.
Did you want to go out of order?
I don't see how.
It's Allison, epidemiologist.
Oh, okay, I'll do it after.
Okay.
Okay. Hi.
Hi,
how are you?
Hi. Our new committee. Hi.
Hi.
It's gonna take a minute to get used to. Okay.
So we have a transfer of funds with a 0 fiscal impact. And just so everybody knows, tonight, all the transfers have no county match.
Yes.
So if you just wanted to explain this, this is daycare, special education.
So number 3 is, and we spoke about this in November, our daycare costs have gone up tremendously over the last 12 months. The eligibility requirements have relaxed a little bit, so we just are having additional referrals. So this is to get us through the last quarter of 2024.
Okay. In the amount of $346,831 with 0 fiscal impact. Okay, make a motion to approve. Agenda item 3. Do I have a second?
Second.
All in favor?
Aye.
Aye. Moving on to 4 is the approval of a fund transfer 24T537 to cover projected costs through the end of 2024. The amount of $22,285, 0 fiscal impact. And this is miscellaneous?
Yep, this is for our Code Blue funding. This is to put individuals in the motel.
Right.
And the 19869 is for the Women's Resource Center.
Okay. And just so everyone knows, that Code Blue is when the temperature goes below 32 degrees, We provide housing for homeless people in need, and also the miscellaneous item, I believe that's for hotel, is that?
Yes.
So there's hotel services for people that cannot go to the shelters?
Also, if there's significant storm, we close down the overnight and put everyone in the motels, and that is 100% funded.
Funded. Okay. Anyone from the committee? Any questions from the committee? No. Legislator Montgomery.
Thank you. Is that Code Blue funding separate from the emergency housing funding that we see? Okay.
Yes.
So, thank you. And thank you for that, because it's been used and it's helpful.
Yeah,
Legislator.
a quick question, again, on the Code Blue. Does any of this go to private organizations as well, like Brewster Cares and things like that?
Brewster Cares is the organization that oversees all of our Code Blue, so yes.
Yeah, that's as Paul knows, coming from Southeast as well, we have a significant, we're the 25th richest county in America by median income, but you'd be surprised how much
It's amazing.
poverty there is in Putnam
I
County.
know.
And anything we can do to help, it's cold out tonight, so, anything we can do to help this program continue and perhaps even grow. There's a need, there's a real need.
There absolutely
So,
is. People don't realize that.
Yeah,
This is the increase too.
thank you.
Thank you. Anyone else? Anyone from the public? Okay. So I make a motion to approve fund transfer. Do I have a second?
Second.
All in favor?
Aye.
Aye. Okay, moving on to number 5. This is for Safe Harbor, which is, Safe Harbor is a program, the funds are supporting all youth identified as trafficked, sexually exploited, or being at risk up to the age of 21. And this is $30,000 and 0 fiscal impact also. Now, the trafficking referrals, I believe they go to Green Chimneys, is that correct?
Correct. Yes. And this is something we do every year.
Yes.
With this allocation.
And this is needed. And this is something else I think that many people are unaware of, that what happens in Putnam County. They don't believe it happens in Putnam County. Okay, I'll make a motion to approve. Agenda item 5. Second. All in favor?
Aye.
Aye. Moving on to 6, approval of budgetary amendment 25A008, Child Advocacy Center, contract renewal. This is just straightforward, amount of $9,193, and again, 0 fiscal impact. Do you want to embellish on anything with that, or?
So during the budget process, we put in kind of a baseline of what we know is going to happen, and then once we've received the grant approval for this is the final year for the 3-year grant award. So once we receive that, then we kind of true up the lines as appropriate to how it's planned to be spent.
Okay, thank you. Anyone from the committee, questions? Any other legislators?
I
Yes.
just had the question, how many cases a year do we see at the Child Advocacy Center?
So we had, in 2024, we had about 175 that went through the Child Advocacy Center, about 500 total.
Thank you so much, Sarah.
Yeah, so just to speak on that, is that my understanding is that I think 550 calls came in, and out of that, about 170 went over to Child Advocacy. So those other calls were not.
They did not rise to the level of criminal or sexual in nature.
Okay, thank you. Make a motion to approve? Second. All in favor?
Aye.
Aye. Moving on to number 7 is budgetary amendment 25A009, also contract renewal for $23,157.
So this is similar in
Yes.
nature to the OCFS one that we just went through. This is one of our other big funding sources of the CAC. And it's a 3-year grant, around $1.2 million for the 3-year period.
Thank
You
you.
didn't have the numbers until the end of the year on this one, right?
Yes, so they have to re-grant every year of the 3-year grant.
Of the 3
so.
years, okay. Any questions, comments? Okay, make a motion to approve agenda item 7. Do I have a second?
Second.
All in favor?
Aye.
And number 8 is the approval budgetary amendment 25A010. This is also code below allocation. So it's it's the same as the other.
It is, yeah, we got more money than we expected to.
Oh, good.
And we didn't have the numbers from the state during our budget process.
So when we went through the budget process, it was around 187,000 was the allocation, but when it actually came down from the state, it was 214. So this
Okay,
is just to put
good.
that additional funding into those
Okay.
lines.
And so the miscellaneous line was 16,131, which will be used for the hotel placements.
That's correct.
And that's enough money for that? Is it?
In addition to what we already put in
Right.
there, yes.
Mhm.
absolutely.
Okay. Thank you. Any questions, comments? Okay. Make a motion to approve. Agenda item 8. Do I have a second? Second. All in favor?
Aye.
Number 9 is the approval for budgetary amendment 25A011. This is computer equipment and miscellaneous items in the amount of $15,337. And is that new computer equipment that you needed in the department?
So this was a grant that was awarded during COVID to Adult Protective Services that was extended. So it was originally expiring on September 30th, and it was extended
Oh,
until
good.
June 30th of this year. So during the budget process, we did not know that, and then they increased our allocation. So that's just to
Okay.
fund the lines as appropriate.
Very good. Thank you. Questions, comments? Yes.
These are the laptops which you guys desperately needed and were asked for months ago. No, these are office desktop computers.
These are for
Yeah.
laptops to replace
That's for the
aging out
laptops.
equipment.
Yeah, just
Okay.
a different department than what we got through the budget process.
That's right. Just want to make sure you're getting what you need.
Thank you.
Trying to utilize the grant money whenever we
Yeah.
can to purchase equipment, so.
That's good. Okay, make a motion to approve agenda item 9. Do I have a second?
Second.
All in favor?
Aye.
Aye.
Number 10 is the approval of budgetary amendment 25A012. This is the state aid pass-through.
This is on the mental health side of things, so this is just all of our mental health pass-through money to Search for Change, People USA, and the Mental Health Association.
Okay.
Greater mental health.
Greater
New York.
Mental Health New York.
Any questions or comments? Okay, that is- Okay, make a motion to approve agenda item 10. Do I have a second? Second. All in favor?
Aye.
Aye. Okay, number 11 is approval of Department of Social Services, budgetary amendment 25A013. And this is similar to, we just passed, isn't it? This is the rental supplement program?
Yes, so this is an allocation that we also received from the state. So the program period is April 1st through March 31st. So this is to fund the first quarter of what was remaining from that allocation for '24.
So this is different than, this is a rental, the rental. So
Yes,
this
and
you
this is-
find-
I'm sorry.
Back to the Women's Resource Center.
Mhm.
This particular funding is utilized not for domestic violence related situations, just unsheltered.
Okay, thank you. Any questions, comments? Okay, make a motion to approve agenda item 11. Do I have a second?
Second.
All in favor?
Aye.
Thank you.
Thank you. Thank you for your time.
Thank you. And agenda item 12, I think Shanna could not be here, so.
Try it though. Try to.
Hello.
Hi, so we're on number 12, which is budgetary amendment for the community health survey. If you could just explain that.
Okay, this is Allison Kaufman.
Hi, Allison.
She's
How are
the
you?
epidemiologist, and I believe she has a slideshow, which is up there
Oh,
now, to talk about
I could look at that one.
why we need this. And
Mhm.
I'll talk about
Okay.
what happened for the funding
Okay.
and why it's not there. After.
Mm.
I know it's the end of the night, so I'll try to keep it quick and
Okay.
not put you guys to sleep. But, I'm here to talk to you guys about the Regional Community Health Survey and why it's a really important part of the comprehensive community health assessment that we are required to do with the health department, that Amy is kind of a ringer on. She knows a lot more about it from being at Board of Health. All right, so we're just gonna level set a little bit and do some definitions. So what is a community health assessment? What it is a descriptive summary of the county's population, so demographics, its health status, so things like leading causes of death, what's the rate of cancer, heart disease, things like that. And factors that influence health, so things like is there opportunity for exercise, you know, that nature. So basically what the whole community health assessment is an amalgamation of a whole different component assessments that we have to put together to cover all that really broad territory. Why do we do this thing? Basically the CHA enables us to do data-driven practice, both in the health department, and that means we look at the data and that's how we develop our community health improvement plan. But also it informs the planning in our regular programs, and other county health departments, because it is so broad-based, can use this information to plan as well. So how does the community health assessment benefit Putnam? The findings from the CHA, we share them with all of our different community partners, including you guys, the elected officials, the department heads, our public. And this really enables all of these different organizations and agencies to tailor their programs to meet the current needs of the residents of Putnam County. So we know that in addition to our health department, the Department of Social Services and Mental Health, OSR, Cornell Cooperative Extension, all of these folks have come to us, and so we know that they're utilizing our data in the CHA, and they're also using it for grant applications as well. How often are we required to do this thing? So we actually have two masters in this. The Public Health Accreditation Board requires that we do a community health assessment at least every 5 years. New York State DOH has just changed the rules a little bit. They're still requiring a community health assessment every 3 years, but now it's only a full community health assessment every 6 years. And so when we say full, it means that we have to do primary data collection, not just looking at other people's data from outside sources, and so that includes things like doing this survey. So a little bit more about this survey. Why is it so important? So this survey was initially developed by 7 local health departments, the FEs and local health departments in the Mid-Hudson region in 2018. It was done again in 2022. And it assesses a really wide variety of things, everything from the quality of life to people, how people report their health statuses, how is your mental health, how is your behavioral health, how is your physical health, health behaviors, are you exercising, are you sleeping, are you doing all of these things, as well as residents' ability to meet their basic needs. And what makes this kind of added benefit with each year that we do it is because we're using the same survey instrument. We can tweak it each year, so if there's something that just doesn't apply, there was something that was going on at a time and it's no longer applicable, we can remove that question, or if there's questions that didn't work well, we can change it a little bit, but for the most part, we leave things the same from year to year, and that gives us the ability to compare how Putnam County specifically is doing over time. And also, because this is part of a larger regional survey, it gives us the ability to not only benchmark by are things getting better or worse in Putnam County, but also how are we doing in comparison to our neighboring counties. So it's a little bit small to see in this environment, but the chart on the slide is an example of one of the questions. So in the past month, have you or any member of your household been unable to get any of the following when it was really needed? And then there's kind of a list. See if my laser goes that far, not quite. There's a list of a whole bunch of different basic needs, from childcare to housing to transportation, medical access, things like that. And again, it's a little small, but what the chart is showing is that we can compare in one chart what the status was in Putnam in 2018, what it was in 2022, and then how we're doing in 22 and compared to MH, that's the darkest blue bar, so that's the Mid-Hudson region. So like, for example, for childcare, you can see that in 18, 4% of the population had trouble finding childcare. That went up to 8% in 2022, but in 2022 we were still doing better than the region as a whole with 12%. So that's kind of the value that you see with this survey. A little bit more specifically about this survey, the contract would be with Siena College Research Institute. That's who we've contracted with the past 2 times. This is a well-known and well-regarded institute that does this kind of work regionally, statewide. They have big clients like the New York Times and also public institutions like New York State DOH. What they do is they actually are conducting a phone survey from a call center. So it sounds a little bit old-fashioned, but it's still absolutely the gold standard in order to get what you need to be able to have the sample size that you need to do a survey like this. So they have a staff of professionally trained interviewers, and they have software that assists with the telephone interviews and entering the data and whatnot. The contract includes a robust sample of 600 responses, and they also work with a data analyst so they're analyzing the data as it comes in to see how representative it is of the county's demographics as a whole. They can kind of tweak which calls they complete based on that, and then at the end the data analyst can actually weight the data to make sure that we are getting a sample that's representative of Putnam County. And what that means is that we are going to have a margin of error of estimated at about 4%, so that when I say that this is the answer, that 80% of the population say that they're exercising at least 3 times a week. That's a little optimistic, but anyway, I can say with confidence that that's within 4% of the answer that we would get if we interviewed every single resident in Putnam County. So that's kind of the value of this that you see there.
Excuse me, plus or minus?
Plus or minus, correct. Yep. We also, so the deliverables that we get are not only the results for each question, but they also give us crosstabs by different population characteristics. So I can see, well, how did veterans answer this question as comparison to households with children, as comparison to a household with people that have a disability living in it. So it allows us to look at these subpopulations and see who might be having more trouble in some areas than others.
Also by age too, perhaps?
Yes, yep. So we get a whole bunch of different, we get gender, age, race and ethnicity, we get different income strata, as well as, and we can actually we can add questions and request certain subcategories as well. So in the last iteration of the survey, we actually paid for it with COVID money, so we had to add some COVID-specific questions. And so we had a breakdown for people who had had COVID or not and long COVID, and you could see how that was impacting some of the other questions as well.
Could I ask through the chair another question? How granular is this? 600 is rather, like you said, robust for the size of Putnam County. Is it broken down geographically? For instance, could we have those crosstabs by town to say which town exercises more, or and maybe not, but I was just wondering how granular it is.
We could. You do start to get into small numbers when you start to get that low, and so even though we do get these crosstabs by all these different groups, that's your margin of error is not just 4% for comparing those two groups, and so you'll see if you read the report that I wrote from the last one, that I get a little bit careful when I'm saying, so usually I'm looking for like a 10% difference in some of those things if I know that the numbers are real close. So yeah, you design the survey for the entire population, and if there was a particular population that we wanted to target that was small, then we would have to set up our sample sizes larger to begin with in order to, you have to do the math at the start to be able to compare this small group to the whole. So at this number, we come in at $48,000, and if we were wanting to, I believe in the very first iteration, they tried to compare like the west side of the county to the east side of the county, and we were quoted a larger amount for, when you start to do subsamples like that.
Thank you.
Yeah. And now I hand it over to Bill to talk about money.
Okay. I think this is in your packet there. It's just a justification, and why this was not in the 25 budget. In July 24, when we were preparing the 25 budget, Dr. Neshwa had intentions of partnering with the hospital. Okay. It would have been a minimal cost, $2,000. And so that's what we anticipated to conduct the community health surveys. But after the 25 budget was approved, we received 24 findings and, and was unable to get adequate and appropriate samples, so it was the shortcomings with that, okay? So that's why it wasn't put in the budget. So I scrambled around and looked for monies that we could use to make this fiscal impact zero. I accomplished that. And where I'm getting the money is every year there's a performance incentive initiative that requires us to do a certain thing within the health perspective. And we've done that. We're going to receive $23,286. Okay, so I'm putting that towards it. That's not enough. So in addition to that, we have an Adolescent Tobacco Use Prevention Act, a TUPA. We collect fines for that. We collected approximately $26,000, and we're rolling that over. And that money can be used for anything that is health related, which this is. Health, so we're using some of that. We're using $13,025 for that. Still not enough. So we decided to, so early in the game, I didn't want to hit any other accounts, but we do have, as you know, vacancies in the nursing division. So to offset, to make it this whole and fiscal impact zero, we're borrowing, or well, not borrowing, we're utilizing $5,800 and $5,800 for 2 of the vacant lines to make this a fiscal impact zero. So what I'm trying to say is we tried to save money in the beginning at the budget process. The data didn't work, so now we're here to request what Allison just proposed. It's be much more useful, right?
So between the ATUPA funds and the public health nursing lines, we have $24,714.
Say again?
$24,714. The appropriations from those 2 lines, ATUPA and
Right.
public health, right? So this is zero fiscal impact.
Correct.
Any questions from the committee? Comments? Legislator Montgomery.
Thank you. I just want to make it clear for myself and for the public, I think, you know me, I don't like to see nursing vacancies. That is so glaring.
Yeah.
And when I see that, I just want to understand, I want the public to understand, there are vacancies that we're still trying to fill.
Correct.
The 5,844 is to date, right? That's what
Well, it's
we
more.
would've-
It's actually more. That's why I split the 2 of them out, in case we ask for more money on those ones. I don't want to have a shortcoming.
And the hope is that we will fill those.
It's well, yeah.
Okay, makes sense. I have another question, if I may.
Sure.
Thanks. You said that, you probably said this, and there was a lot of information, it was really great. But the cost to separate it into east side, west side, what is the additional cost of?
So I believe to go, so we didn't spec it in that way, but to go up to 800 sample size this was 48, I believe that was $60,000.
Yeah,
According to the chart, quickly, because I read it quick.
Want me to bring it up?
No, that's okay, but it's just the needs increased from 2018 to 22 on every line.
Yeah.
If I
Yeah,
can.
and again, a lot of them were within the margin of error,
Yes.
but a lot of what we were looking at there was that the reason why we could easily justify using COVID funding for it the last time was that survey was really timed. It was done right before the pandemic started, and then as the pandemic was kind of tailing off. And so it was a way for us to really see these 2 point-in-time measurements for the impacts of how so many things changed in people's lives and were impacted. So it was really super valuable in that
Be
way.
interesting to see now moving forward what happens.
Yeah,
Anything,
absolutely.
Legislator
The chair.
Sage.
It says here that we were unable to get an adequate and appropriate sample. Does that mean that these numbers are not going to be as reliable? Is that what that means?
No,
What does that
what
mean?
that means is that the alternative survey that we did in partnership with the hospital was done just what we call a convenience sample. So you might have seen, there was a lot, we worked really hard to promote this thing and try to get people to do it. It was a new Vans Day advertised.
QR code?
There was a
I took that to my
code,
gym.
there were,
I see
yep,
everybody,
so we were trying to get, so basically what you're doing is you're reaching out to people, you're giving them a link or a code, and you're saying, please take our survey. And we've tried to do surveys, a number of them at the health department that way too, and you can, if there's a hot button issue, you can get a lot of people to answer them. During COVID, when we were doing vaccination surveys, I was watching them come in and getting 700 responses for these community health surveys that are long and take a little bit of effort to do. Yeah, it's really, really hard. So, you know, we had news releases on it. We had it on social media repeatedly. We had it out to all of our partners. We had people standing in line at the DMV trying to get people to take the survey, and we topped out at about a little over 200 responses. That's fairly typical for when you do a convenience survey that way. And you also typically, you have no way of getting a representative sample. So what happens is, and this is across the board research with survey, just bias in who tends to take them. You almost always get older people and women taking them more than, not gonna weigh in on why. It's just the way it goes. But it's hard to speak for the whole county when you're getting these, you know, like pockets that are answering the survey.
Okay, thank you. Anyway,
Can we
Legislator
pull up the
Montgomery?
chart one
Sure.
more time? And what's glaring is childcare as always. I think that's a big issue.
Yeah, that's why I chose that one to
Yeah.
highlight.
And I think that's a hot issue in the state budget this year. I know that Pattern for Progress did a complete study on that. And I wonder if with any of these, because they are such hot topics, childcare, housing, transportation, and there is, to Legislator Crowley's point, there's always grant money for those things somewhere.
Mm-hmm.
And is there an opportunity to find grant money for this project in pieces? Like, hey, it's gonna involve a study on, or collecting data on childcare, collecting data on housing.
Yeah, I think that, like I said, I think that is what we tried to do with COVID in the past, because we could, there was a pot of money, and as long as we could explain why. I don't know that because this is so broad-based and it's touching on so many topics, that we're not a child care agency, so we're not usually going to those wells to look for grants on that subject, because we have one question in a survey that is related to child care. So, I mean, I think that that's something that we could, well, it might be a stretch, but it's also, honestly, the amount of staffing that it takes to be going through all those NOFOs and applying to all those grants is, we don't have a grant writer.
We need nurses before grant writers, I think at this point. Thank you.
Anyone else?
You can, grant writer.
Okay, let's make a motion to approve
Thank you for that.
agenda item 12. Do I have a second? All in favor?
Aye.
Thank you.
Okay.
Thank you. Other business, we do have other business this evening, 13A. I make a motion to accept. Other business, do I have a second?
Second.
All in favor?
Aye.
This is grant renewal, Office of Victim Services. This is a 3-year contract, and it's up for renewal. So, you want to speak on this real quick?
Sure. I apologize, we're still learning the process, so thank you for your patience. This is a 3-year grant totaling $1.2 million over 3 years for the Child Advocacy Center. The grant period will begin on October 1st, 25, and we have to submit next month.
Any questions, comments?
Thank you, Sarah.
Okay, thank you.
Thank
I make
you.
a motion to approve 13A, the business. Do I have a second? Second. All in favor?
Aye.
Thank you, Sarah.
Thanks, everybody.
Moving on to 14, make a motion to adjourn. Do I have a second? Second.
All in favor?
All in favor? Oh, I forgot to say all in favor.